My big research question is whether speech and language therapy, as in speech and language therapy interventions, can be useful, can help people living with dementia, and also whether they can help the people around the person with dementia. In my research so far, we have found that speech and language therapy interventions are valued by the people who receive them, by the people living with dementia and their family members, their carers, their communication partners. We also know that the speech and language therapists delivering the interventions feel empowered by interventions that have been specifically designed to meet the needs of people living with dementia. And that's really important because a lot of speech and language therapy was developed for people with stroke-related language and communication difficulties, or people with brain injury-related communication difficulties. And we're now having to tweak those to meet the needs of this population of people with dementia. And we have also gradually found that we think that these interventions are effective, but that research, that work, is yet to be really evidenced properly. This research is really important because at the moment we don't really have any pharmacological interventions. We don't have any medicines that can cure dementia. So there's lots and lots of people living with dementia. In fact, the number of people living with dementia is increasing at an enormous rate. So by the year 2050, we think there'll be over 2 million people living with dementia. And we need to support and look after these people and provide them with quality of life. And we know that communication is one of the most difficult things for the people around the person to manage. So for example, in stroke-related communication difficulties, we know that often people who have these are more likely to have experienced relationship breakdowns than people who don't have communication difficulties. So all people, I would say as a clinician, all people with dementia present with communication difficulties. And if we can support them and their relevant others to maintain their communication and maintain their relationships, we anticipate we can also maintain their independence, their quality of life, so that they can, for example, stay at home with their families for longer. They potentially wouldn't have to go into nursing home or care home accommodation, but essentially that we can support people to have quality interactions and quality relationships. I think it's really important to add that the area of speech and language therapy for people with dementia is developing, and one of the biggest barriers is that people don't know what speech and language therapists can offer. So more broadly, that includes both medical, so health professionals, and the population at large. So because of that, many people won't actually be referred to speech and language therapy to receive these interventions. That's a really big barrier. So medical professionals are often a gateway to our services. So one of the key things we also need to look at in developing these interventions is developing the care pathways that go with that, developing the knowledge of the community, both the health care professional community and the wider community at large, and then developing the research evidence that demonstrates its effectiveness so that commissioners can commission our services and keep up with that need. Not only can we support people to make decisions at the time the decision may need to be made, we can support people to maintain their voice in future healthcare decisions, so kind of making advanced decisions. We can also support people in expressing their preferences once they've lost decision-making capacity, so making best interest decisions for them, and supporting the team to do that. And I think there's lots of work that can be taken from the world of speech and language therapy, from the research we've done, and lots of research that needs to be done to really demonstrate the role of the speech and language therapist in this area.